So let us now look at the 4 weeks trends. That is the week between June 28th and July 25th. So there's been an average increase of 4% of new cases over that time period, with the breakdown as follows: 38% increase in Western Africa, 24% increase in Northern Africa, a 3% decrease in Central Africa, 1% decrease in Southern Africa, and a 0.1% decrease in East Africa. In terms of the new deaths over the last 4 weeks, we've recorded an average of 17% average new deaths over that same period, with the following breakdown in terms of the most populous countries: Nigeria, 29% average increase; South Africa, 27% average increase; Egypt, 32% average decrease; Ethiopia, 18% average decrease; DR Congo, 14% average decrease; and Kenya, no change. In terms of testing, as a continent, as of today, we have conducted about 58 million COVID tests. And last week alone, the continent conducted about 1.3 million tests, but that represents a decrease of about 19% over the previous week. The overall positivity rate stands at 11.2%, with a test per case ratio of 8.9, which means we are not testing at a level we should be testing. 31% of our member states, or 17 countries, are reporting test positivity rates of higher than 12%, which means or reflects an extensive community transmission. The Africa CDC continues to support member states in their ability to respond to the COVID-19 pandemic. Especially during this second wave, we have organized what we are calling the swap teams and deploy them to several countries, from Seychelles to Cameroon to Sierra Leone and Zambia, Namibia, to support them to fight the third wave. And I just came back last night from Tanzania to meet with the leadership of that country to continue to work with them and support the leadership there to implement a more aggressive COVID response strategy. That is all part of the SWAP team that we've deployed across the continent. I will, as I indicated earlier, leave the vaccine piece to Dr. Moeti so that she can expand on that. So Wayne, please, I'll turn back the floor to you. Thank you.
Thank you very much, John, for that briefing. And now let me introduce Dr. Matshidiso Moeti, and she is the Regional Director of the World Health Organization's Africa region. And as Dr. John has mentioned, she will be talking to us about the acquisition of vaccines in Africa. Dr. Moeti, it's over to you.
Thank you. Thank you very much. And a very good morning and good afternoon to all the journalists who've joined us in this press conference online. I'm very pleased to join my brother, Dr. John Nkengasong, in this briefing. And I'd like to commend John for your leadership, for the intense and sustained action that you have put in place with your team to support African countries. It's absolutely unprecedented. And we are very, very pleased indeed to be working with you and your team. So in this briefing today, of course, John has already outlined the situation as far as the pandemic is concerned. And I'm going to say something to you about the ongoing efforts to step up vaccine acquisition, delivery, and rollout on the continent. As Dr. Nkengasong has said, the continent is still in the throes of the pandemic's third wave, although we've observed a slight slowdown in cases in the last 2 weeks. But we know that many things are happening daily, including we've just had the Eid celebrations that continue to fuel the spread of the virus. So we need to be monitoring these changes daily and monitoring these limited gains closely, we know that we're not out of the woods yet by any means. This has been the fastest rising surge, powered mainly by people's fatigue with COVID-19 preventive measures, with the presence of more transmissible variants and the continent's very low vaccine coverage rates. However, our greatest barrier to overcoming this pandemic really remains vaccine inequity. We cannot get ahead of the virus if vaccines are not reaching a significant proportion of the population. And the African continent has fallen far behind the rest of the world in terms of vaccination. Just 21 million people, or 1.6% of the continent's population, are fully vaccinated. However, we know that despite the vaccine supply crunch, 7 countries, including Equatorial Guinea, Mauritius, Morocco, and the Seychelles, have reached vaccination rates significantly above the continental average. And about 30 countries have used up more than 3/4 of the vaccines they received. Encouragingly, we're beginning to see positive signs as vaccine deliveries to Africa are picking up pace after coming to a halt. So considering a 2-dose schedule, as is the case with most of the vaccines available, 820 million vaccine doses are needed to reach the target of fully vaccinating 30% of Africa's population by the end of this year. In comparison with only 245,000 doses that were supplied to just 6 countries in the whole of June, over the past week alone, 3.8 million vaccine doses were delivered to 13 countries through the COVAX facility, bringing the total doses delivered to the continent to 82 million. These recently delivered vaccines are part of 60 million doses that COVAX has allocated to 49 African countries to be shipped between now and September. Africa still needs more than 700 million doses to reach the 30% year-end target. And COVAX has also sealed deals with Sinopharm and Sinovac to supply 110 million doses for immediate supply to low-income countries. And out of these, 32.5 million are coming to Africa. These doses have been allocated to countries this week and will be delivered as soon as the countries are ready to receive them. With more vaccine candidates and manufacturing sites at the tail end of the review process for approval by WHO for emergency use listing, the COVAX facility is confident, or hopeful, let me say, that it will meet its end of the bargain to deliver at least 520 million doses to Africa by the end of 2021. We are really pleased and we commend the action of the African Union in also going out and seeking vaccines. And they have announced plans to start delivering the 400 million Johnson & Johnson doses that have been acquired and procured on behalf of African countries. This collective efforts needs to include increased donations from high-income countries. We have very much appreciated the action of the US government in providing millions of doses already through the COVAX and in agreement with the African Union that have completed. So we expect countries that have completed vaccination of most of their vulnerable populations to join the US and to increase the doses that they are proposing to deliver and do that urgently. And also, very importantly, to release for purchase by COVAX and AVAT the reserved doses of vaccines that they have already prepaid with the manufacturers. In short, we promote very strongly the enlightened self-interest aimed at reducing the emergence of more variants for everyone by these countries donating and allowing the sale of the vaccines that they have already booked, so to speak. With the expected influx of vaccines, it is crucial that countries scale up all the aspects of vaccine rollout to reach as many people as possible. This entails mobilizing adequate resources, including finances for the vaccination activities, for logistics and the personnel, as well as addressing any concerns by communities, including those fueled by misinformation, to increase vaccine confidence and demand. We continue to support countries to better plan and cost vaccines operational and delivery processes. In the first phase of the rollout, countries were unable to lock out funding very often because costing plans often omitted critical expenses such as the cost of remuneration of vaccinators, administration, cold chain storage, logistics, and distribution at the subnational level of vaccines to the delivery points. Our experts have been on the ground since the onset of the pandemic, working with governments and partners to curb the virus by boosting key response measures, including through the testing, contact tracing, treatment, vaccine preparedness, rollout, and monitoring of any adverse events due to the vaccines. To date, WHO in the African region has deployed over 700 staff and consultants to support national authorities in the COVID-19 response. In addition, almost 1,300 of our staff have been repurposed to focus on pandemic control activities. African people, just like the rest of the world, are eager to see a return to normal life. But we must all do our part by getting vaccinated when the occasion is there for us, when the jabs are offered to us, and adhering to the preventive measures that have been so important in limiting transmission of the virus in Africa. I believe together we can begin to turn the tide against this untold human tragedy. And I look forward very much to our conversation today. And thank you once again for having joined us. Thank you, John, for having invited me to join. I hand over back to you, Madam Moderator.
Thank you very much, Dr. Matshidiso Moeti of the WHO, talking to us there about vaccine acquisition, as well as some of the response activities that are being undertaken by the WHO. Now it's time for us to move into our question and answer session. But let me just remind you of how you can send in your questions. So the first one is to use this WhatsApp number, +251 9455 2310 +251 9455 2310. Alternatively, you can come to us live or use the question and answer section. So let's move on to our first question for today, and it's coming from Kara Anna, who is with Associated Press. Kara says, thank you for this briefing. Now that Tanzania has started COVID-19 vaccinations and Burundi says it will accept the vaccines, that leaves only Eritrea. What reasons has Eritrea's government given for not pursuing vaccines? Dr. John, you will take that first question.
So thank you, Kara, for that question. We don't have a specific reason why Eritrea has not made a pronounced itself on that, but we continue to hope that the situation will change and we'll continue to engage them. As I just mentioned, I just came back from the Tanzania last night and had a very good conversation with the leadership of that country, the new leadership. And the president herself, President Excellency Samia Hassan, was very supportive. And we spoke about the COVID pandemic very openly and very freely. And before I left yesterday, I was delighted to see that she has taken her vaccine. And we are committed to working with them to rolling out the 1 million doses of vaccines that they just received as part of the U.S. supply. So we are very encouraged. The Minister of Health was extremely supportive, and we look forward to doing our little best to support that effort. Similarly, in Burundi, we'll continue to engage with Burundi. And in the coming weeks, of course, we will be intensifying our efforts there to understand the gaps and areas where we can support them. And similarly with Eritrea. So again, just to conclude, my answer on that question is that the concept and philosophy at the African Union is that we leave no country behind, because we are not going to win this battle against COVID-19 on our continent if any country is left behind. So we take that very seriously, and we will keep you updated as we make any significant engagements with any of these countries.
Thank you very much. Let's go to colleagues coming online. And the first one today is Daniel Arap Moy. Good morning, Daniel. Please tell us your news agency and ask your question, as well as tell us who it is directed at. Over to you, Daniel.
Well, thank you very much. My name is Daniel Arap Moy from CGTN Africa, based in Nairobi. My question goes to Dr. Moeti, the first question, and the second question I'll forward to CDC. To Dr. Moeti, researchers are now raising concerns over cases of individuals who are testing positive for coronavirus despite being fully vaccinated. Now, this then raises the question, how protected is someone who has already been fully vaccinated against COVID-19? And how rampant are cases of breakthroughs in Africa?
Dr. Moeti.
Okay, thank you. That's a good question and an active concern in many countries today. I think that it has been known that the vaccines will not altogether prevent transmission. I think some of the ones with the highest efficacy, like the Pfizer BioNTech, cause people not to have very low viral loads after being fully vaccinated, meaning that their ability to transmit the virus to others is limited. What we have understood is the main benefit of these vaccines, of all the vaccines, is preventing people getting severe forms of the illness such that they need intensive care and preventing people from dying. So it seems also that the Delta variant, which is becoming predominant now virtually all over the world, which is certainly circulating in over 25 countries in Africa, we believe, is more transmissible and is more transmissible even among people who have been fully vaccinated. So I think people need to understand that we take the vaccine, of course, to reduce the rate of transmission of the virus, but also very much to reduce severe illness and to reduce deaths. As you are aware, there is a debate going on now, and I believe that the American government is about to issue guidance on the use of masks by people who have been fully vaccinated in the context of this highly transmissible Delta variant, which is circulating in many, many countries. So what I would say to people is that do take the vaccine. It will reduce your chances of being infected. It will not eliminate them altogether, but we have seen there are very few deaths among people who've been fully vaccinated, and there are very few severe cases of this form of illness among people who are fully vaccinated. And that is a huge benefit already in terms of our objectives in the vaccination.
Thank you very much, Dr. Moeti. I think we can now move on to Judith Akolo, who is with the Kenya Broadcasting Corporation. And she says, I would like to ask Dr. John Nkengasong, is Kenya also experiencing its fourth wave like Tunisia and Nigeria? Because yesterday, Kenya registered 1,006 new infections from a sample size of 5,584 and an infection rate of 18%. What determines a new wave? Is it the infection rate or the death rate? Dr. John.
So thank you. I have not, I've been traveling the last couple of days, so I've not looked at the data country by country as I usually do. And tomorrow will be that day where we look at the entire spectrum of where we each country is, and I'll be able to look at Kenya more closely to see how their daily, the 7 days moving average is where it's trending towards. So, I mean, we look at the 7 days moving average and to look at and make a determination if they continue to bend the curve or the curve has flattened and then is ticking up. So that is at that point that we raise an alarm that a country might be moving towards a subsequent wave. So I think that is, at this point, Judith, I cannot tell you if, based on the information that I have, that Kenya is actually moving into the fourth wave or not. But that information should be made available hopefully next week when we have this discussion.
Thank you for that. The next one is for Dr. Moeti. and it's coming from Bonisile Makubu from the Times of Eswatini. She says countries like Eswatini are seeing high numbers of new infections among the 0 to 19-year age group. Considering this, what would you advise on the opening up of schools?
Okay, thank you very much. All countries are facing this dilemma between letting life go back to normal and really covering some of the gaps that have been imposed by the lockdowns in all spheres of life, economy, education, very much, which is a big concern, and other socioeconomic activities against the risk of worsening the situation in terms of transmission. Certainly, if young people are going to be going back to school, which is a very important objective, then there needs to be a lot of investment in ensuring that this does not result in super spreader events within the classroom and children taking the infection back home, where they are likely to infect adults who may be vulnerable to falling seriously ill and dying. I think that is the logic. So each country needs to look at its own situation. What is the rate of increase of cases? And I think that Eswatini is among the countries that have been among those experiencing what we call resurgence. So there needs to be a lot of caution applied to whether the prevention measures, the distancing, the wearing of masks can be put in place effectively in Eswatini, so that we don't have young people who are at school being the source of infection to those who are more vulnerable before the vaccination of older people who may be vulnerable, who are vulnerable to more serious illnesses can take place. So it is a balancing act, and the government needs to weigh this up very carefully. And I would say that, of course, we would like children to go back to school. We want girls especially to go back to school, so to minimize the risk of children dropping out forever, which is a huge risk in the current situation. But we certainly would advise against doing this without putting in place the proper prevention measures to ensure that this does not worsen the overall situation in the country. And we know the measures to put in place to ensure this.
Thank you very much, Dr. Moeti. Sophie Mukwena is online, and Sophie is with the South African Broadcasting Corporation. Good morning, Sophie. Please go ahead with your question and just tell us who it is directed at.
My question is directed at both Dr. Moeti and Dr. Kengasong. The issue of the third wave, taking, for example, South Africa, we were experiencing a third wave, and last week the president took a decision to relax measures that were intended to fight this third wave. Is it too early? Because yesterday the numbers that were reported were very high. But secondly, much as there was decline in positive cases, the death toll is much higher than the first wave and the second wave. What could be the disjuncture? And also the recent unrest and gatherings in South Africa, at what point are we likely to see the implications and the impact thereof on rising numbers and death toll? And are we going to really have a break before we go to the fourth wave?
All right. Thank you very much, Sophie. Dr. Moeti?
Yes, thank you. I mean, again, a question of balancing between the situation of the pandemic, the severity of the third wave, and indeed there is a third wave in South Africa, which has been also spreading to the sub-region because of the close links between South Africa and neighboring countries, and the need to reopen the economy. I think the situation in South Africa, you mentioned the recent unrest, looting, etc., which I think we need to acknowledge may have been triggered by particular events, but had as part of the background the severe economic impact on low-income people of the COVID-19 pandemic, including some of the measures like the lockdowns that needed to be imposed. And I think the government had to balance that against what was emerging as a slowing down of the pandemic. There had already been a decrease in the number of daily cases. So it, again, was having to see the measures of opening up, taking into account the severe economic impact and reinforcing the prevention measures at the same time as loosening up some of the lockdown measures. What I do know is that what was opened up was, for example, inter-provincial travel. Now the curfew remains, but perhaps is later. And then restaurants have been allowed to open, and the sale of alcohol is allowed. I think that the country now has gained experience in monitoring how things are going. Clearly, we may be expecting to see, following this reduction in cases, an increase in the cases where some of the worst gathering, when the looting was happening, occurred. This should be starting to show very soon. But I believe that before this decision was taken, the government must have taken a very detailed look at the trends, at the measures, and the available resources for ensuring these measures are implemented. And we know that they are able to monitor the situation and adjust. They've had experience now in readjusting these measures closely. So your question is very valid. I'm certain it's being analyzed on a day-to-day basis. And if the trend seems to be going back up again in a sustained way, I'm certain the government will take the right decision then. It's very much a balancing act for all countries.
Thank you. Dr. John, do you have a comment on that question?
No, I think, Dr. Moeti very nicely laid out the explanation. It's a balancing act. The government is faced with a choice of saving lives and saving livelihoods. And that is a situation that will only be addressed once we roll out vaccines in a significant way. And South Africa has one of the best public health experts that I can think of, and they do analyze the data very regularly. And I was in South Africa just 5 weeks ago, met with the ministry, met with researchers from Caprisa, and very impressed with the way they are looking at triangulating data to use that to guide the response. I absolutely have no doubt that they know what they are doing. And this is the third time they are bending the curve. And let me just say that the 15% decrease that I just mentioned, when you look at last week compared to this week, is largely due to what is happening in South Africa. So I think that South Africa has become, just like Kenya, they've become veterans in bending their curve down and relieving their health system. The people always ask me the question, which are the countries in Africa that has done better than others? As well, most countries in Africa have done very remarkably well. Nigeria, South Africa, Kenya. Because if they were not doing that, you probably would see an escalated situation where the health system will be completely overwhelmed. So if you plot those graphs there, you see nice peaks. They come down, they go up, they come down. It's because of the balancing act that Dr. Moeti mentioned between saving economies and saving lives there. So you continue to see that, Sophie, until we are at a steady state where vaccines would have been introduced and everybody can actually begin to, life can actually begin to return to normal.
All right. Thank you very much, both. Let's move on now to Hilary Orinde from Agence France Presse. The Burundi Health Minister, Dr. Ndikumana, yesterday said they are ready to act.
The Director General of the Africa CDC there, Dr. John Nkengasong, talking about the countries that are still experiencing challenges, but there's movement, which is Tanzania, Eritrea, and Burundi. But the African representative of the World Health Organization, Dr. Tsidi Moeti, giving a slightly sunnier picture in terms of countries such as the Seychelles and Mauritius and the way they're conducting their processes. But let's